Today I'm going to talk to you about complementary and alternative medicine treatments for women in pain. But I want to start off with a little lighthearted song that you may have heard, or variation on something that you may have heard when you were a child, about connections. The shin is connected to the knee bone. The knee bone is connected to your flexibility, and your flexibility connects with your body weight. Your body weight is connected to your intake of green leafy vegetables, which connects with your white blood cells, and your white blood cells connects with your stress level. Stress is completely connected with how well you sleep, and how you sleep is connected with your attitude and depression. Depression connects with the endorphin levels in your brain, which connects with your cardio program, which is completely connected to your lung capacity. Your lung capacity connects with whether or not you smoke, and smoking connects with heart disease, cancer, stroke, asthma, impotence, and the health of those around you. And all these things are connected to your relationships, because the body is connected to the mind, is connected to the spirit. Now I would love, thank you, I would love to take credit for this, but these are the words from a commercial from an insurance company, Kaiser Permanente. They gave me permission to use these words. Now, if they are finding these connections, surely your doctors should find these connections. I should give you definitions first, so that we can all be on the same page. Complementary complements conventional medicine, using in conjunction with. Like after you have surgery, maybe if you have aromatherapy, you can relax a little bit more, and maybe your pain is not quite so much. Alternative is considered something in place of. Instead of having chemotherapy, you may change the way you eat. Now, acupuncture is one of the most commonly known forms of complementary medicine or alternative medicine. That's been around for about 5,000 years. It's still here. There's a reason for that. Medicine, the way we know it now, Western medicine, conventional medicine, has been around for about 500 years. And wonderful leaps and bounds and strides have been made with it, but it still leaves gaps. I believe that Western medicine has its benefits, alternative medicine has its benefits, and both have gaps, but together you get the best of all worlds. A lot of the additives in the foods that you eat, especially packaged foods, are working against you. One big group of additives is called excitotoxins. One most commonly known excitotoxin is MSG. And most people know to stay away from MSG. But what you don't know is that it can be hidden in a lot of the foods that you eat. It's used to make low-quality foods taste really good and rich. But it does that by exciting the taste buds. But it's not that specific for just taste buds. It excites nerve endings. So if you've got irritated nerve endings from some injury, or some pain, or from some pain syndrome that you've had going on for a while, and you've done everything that everyone's told you to do, you've been really good, and you're wondering why you're still hurting, look at what you're eating. Eliminate refined foods. 3 days. 3 days. See how you feel. I'll tell you this story. They told me to come to the edge, and I told them I was scared. They told me to come to the edge, and I said, I'll fall. And they said,